Bismillahirrahmanirrahim. Today we will make a short video about the erythema nodosum. Erythema nodosum is a very hard topic for the MRCP examination. So, what are the erythema nodosum? Erythema nodosum are painful nodule over the anterior of the leg. Painful nodule over the anterior of the leg without ulceration. This is a rule for the erythema nodosum without ulceration. Erythema nodosum will not ulcerate. Erythema nodosum is self-limiting condition. It is a self-limiting condition and it usually resolves on its own in 6 weeks. Resolve in 6 weeks. This condition is more common in female as compared to male. Female to male ratio is 10:1. More 10 times more common in female as compared to male. And erythema nodosum are actually paniculitis. Paniculitis means inflammation of the underlying pit. Paniculitis. Paniculitis. Inflammation of the pit. There are many causes of erythema nodosum. But to easily remember the causes of erythema nodosum, a mnemonic Nodosum is used. Nodosum. This is a mnemonic to easily remember the causes of erythema nodosum. N is for the no identifiable cause. No identifiable cause means idiopathic. O here is for the pregnancy. O here is for the pregnancy. Pregnancy can cause erythema nodosum. D here is for the drugs. Which drugs? It includes penicillin, sulfur drug, allopurinol, antiepileptic, and many others. Penicillin, sulfur containing drugs, and antiepileptic. Allopurinol can also cause the erythema nodosum. Allopurinol. O here is for the OCPs, oral contraceptive pill. It is also a drug. S here is for the sarcoidosis. Sarcoidosis. U here is for the ulcerative colitis, means the IBD. IBD means ulcerative colitis. M here is for the malignancy. Malignancy can also cause the erythema nodosum. But there are some infection which can also cause the erythema nodosum. Infection like TB, streptococcal infection, and fungal infection. And another cause, that is Behçet disease. can also cause the erythema nodosum. So when a question mentions that there is erythema nodosum or says that there is painful nodule over the extensor surface of the leg, then you should have nodosum mnemonic in your mind. But do not forget the TB, streptococcal infection and fungal infection. And last one is the Behçet disease. Treatment of erythema nodosum. Now, what is the treatment of erythema nodosum? As we have already discussed this, erythema nodosum is a self-limiting condition and it usually resolves in 6 weeks, but it may recur. So the treatment, it is self-resolving condition, self-resolving condition. But for pain, you can give the NSAIDs. NSAIDs. So here is a question for you. A patient presented with shortness of breath, arthralgia, fever, and there is painful nodule over the shin. You did chest X-ray for this patient, and there is bilateral hilar lymphadenopathy on the chest X-ray. So what is your diagnosis and what is this lesion? So what is the name of this lesion? Painful nodule over the shin. This is erythema nodosum. And bilateral hilar lymphadenopathy along with the shortness of breath, arthralgia and fever. This make the diagnosis of sarcoidosis. Your diagnosis is sarcoidosis and the name of this lesion is erythema nodosum and the treatment is the NSAID. So this was a video about the erythema nodosum.